been asked in the chat, and it's something that we were talking about beforehand. So I guess I'm just going to ask it. How do you know that it's time to go through with surgery? So if you've been told, for instance, that by one surgeon that the child needs surgery and by another that they do not, how do you kind of know what the right decision is? What are the, yeah, I know.
That's a tough question. That's a tough question. Because, you know, in the end, we're all kind of, you know, if I step back and consider myself as a parent in something other than the field that I know, right? If I've got, you know, two surgeons telling me that my child needs surgery or doesn't need surgery, how do I make that decision? That's a tough spot to be in. From my perspective, though, you know, when it comes to Chiari, how typical are the symptoms that you're having? Because what you really want is to get better, right? You want to do an operation that's either going to make you feel better or prevent you from getting worse in the future. So that means when we talk about preventing you from getting worse, that means, is there syringomyelia? And if there is, then surgery is almost always indicated, almost always the right idea, because we know that the natural history, what happens without surgery, is bad. So that one's kind of easy. Where it gets tricky is when we're talking about what symptoms are you having. And if it's a kid, sometimes it's not easy to tell. You know, particularly if it's a young child, you know, do you know if they're having posterior headaches when they cough? It can be pretty tricky. You know, if it's a teenager and you can talk to them and are these symptoms typical or not, that can sometimes make the decision easier. But with a young child, it can be a bit of a judgment call. You know, as an example, a child who you know really has terrible constipation, because you know that happens because over time they're reluctant to have a bowel movement because it hurts to push, and then eventually that stool becomes impacted and you end up with constipation. So does Chiari cause constipation? Well, no, but if a child doesn't want to cause the headaches by having a bowel movement, then it might end up causing constipation. So these things can be a little tricky to sort out. I can't really give you any guidance as to you know, find the surgeon that you're most comfortable with, that you know, understands what you're going through and is confident that they can either offer you something that's really beneficial or are quite confident that surgery is not going to be beneficial. Like, this is a tough question.
Yeah, so I guess to kind of package that, would you recommend maybe asking whatever surgeon that you're seeing, will my symptoms get better if I have this surgery? Like kind of like a yes or no question. And if the answer,
absolutely. If you're going to have surgery, it's going to be for one of two things. It's going to either make you feel better or prevent you from getting worse in the future. So those are the questions to ask. You know, doctor, how is this going to help me feel better or keep me from getting worse?
Yeah, perfect. Before I move on a little bit, there was a question about when is surgery contraindicated? So if there's a syrinx. So if you have a big syringomyelia, is there ever a situation where you would not have surgery?
So the short answer to that is no. If you have a large syrinx, you need to do something about it. Now, that being said, if you have a very large syrinx and you have a Chiari decompression and the syrinx gets a little bit smaller, but it'll never go away. It's kind of like a balloon. Once you've blown it up, it never goes back to its original size. So if you have some persistent fluid in the spinal canal after Chiari decompression, that may be okay. But if you have an operation and the syrinx doesn't get any smaller, or it gets bigger, or if you have a syrinx and you've never had an operation, that's almost always a reason to have surgery. Now, that being said, in some very complex cases, there are other abnormalities at the base of the skull and at the junction between the skull and the spine, so the craniocervical junction. And you have to consider those as well, because sometimes if you only do a decompression, if you just remove bone and make the opening bigger, you can destabilize the spine and actually make things worse. So in those circumstances, it's important to also consider, do you also need a craniocervical fusion, so an operation to stabilize the craniocervical junction and fuse the skull to the spine. Those are incredibly rare. The simple answer to the question is if you have a syrinx, surgery is indicated. You have to keep in mind that in some very complex and very rare situations, you may need more than just the typical operation.
Mm-hmm.